Treatment for baldness in its early stages and the causes. Premature baldness is one of the issues that males face more than women, despite the fact that there are therapies that can help. Premature baldness, alopecia, can affect the scalp or the entire body, and the effect can be temporary or permanent. In most situations, this problem is caused by a hereditary reason, hormonal changes, or medical disorders, or it could be a natural part of aging. Early baldness is more common in men, and one of the most important factors in its prevalence, especially as the individual ages, is a genetic element. Many people do not treat this problem and leave it untreated, but others use makeup to fill in the gaps, hats, scarves, or different hairstyles to mask baldness, and some people utilize various therapies to prevent hair loss or restore hair growth. Early baldness causes. The genetic cause is the main or primary cause of baldness, i.e., the genes that an individual inherits from his parents, and scientists believe that genes may affect the sensitivity of hair follicles to the hormone DHT, which causes shrinkage, as well as other factors that cause baldness and hair loss, such as having certain conditions, such as anemia or thyroid gland disorders, radiation or chemotherapy treatment, using certain medications to build muscle, such as blood thinners, high dosages of vitamin A, and anabolic steroids. The presence of dietary issues, such as getting a low proportion of iron or a lot of vitamin A. Premature baldness can be caused by stress and anxiety, as well as scalp infections. Treatment for baldness in its early stages. Early baldness is treated in a variety of ways, with the following being the most common. First, there are pharmacological therapies. The use of some over-the-counter drugs that do not require a prescription. The U.S. Food and Drug Administration, FDA, has approved the use of two types of medications to treat early male pattern baldness, namely Minoxidil. This treatment is accessible without a prescription and comes in the shape of a foam or liquid that is applied to the scalp twice a day to promote hair growth and prevent hair loss. Finasteride. This medication can be taken on a daily basis but only with a doctor's prescription. Hair transplantation. Follicular unit transplantation and extraction are two of the most popular hair transplant procedures. Follicular unit transplantation, FUT, this procedure involves removing a strip of skin from the back of the scalp, where hair is abundant, and then removing hair follicles from this strip of skin, which are then reinserted into the part of the scalp where the person suffers from baldness and hair loss. Follicle extraction unit, FUE. In this procedure, hair follicles are extracted from the scalp and transplanted to the areas of the body where the person is bald. It should be emphasized that because hair transplantation is a medical procedure, it can be painful and costly. 3. Laser therapy. Many individuals feel that early laser baldness treatment lowers inflammation in the follicles, which inhibits them from growing, and that low-level laser therapy, LLT, is safe and successful in the treatment of baldness and hair loss in males. 4. A change in lifestyle. The following are some of the most essential lifestyle adjustments that an individual must undertake in order to treat early baldness that he may be experiencing. Quit smoking if you can. Massage of the scalp. Consume a well-balanced diet. Running some tests now and then. Reducing anxiety and stress.